Welcome to SDAHO's Soundbites, short audio clips that focus on specific topics from our webinar sessions. Today's soundbite comes from our February Medication-Assisted Treatment webinar.
What about opportunities for improvement, would you say? Just in general, across from what you see?
Yeah. I mean, I think that one of the things that we probably all could be is just assessing for it, screening for it. I think that's an opportunity for improvement, is just making that a routine part of an intake for patients. Because it may be that we just don't know what tool to use, or we're just not comfortable with it, or it may be that we don't feel like we have the resources afterwards to kind of address the issues when we find them. But I do think we need to be asking the question more, because it's pretty clear that there are issues out there in the community. There's a lot of people that are struggling with medication mismanagement. There's a lot of street drugs. I think that for me, I know we're talking about opioids, but there's so much work that needs to be done in the area of methamphetamine dependency, stimulant dependency. That is the issue. I can get people off the fentanyl and the heroin. They're doing so well on the buprenorphine, and then we start shifting into a different substance like meth, which was something they've never struggled with. And for me, that is incredibly frustrating. But I think what's happening is we're not really addressing maybe some of the trauma that's happened in their life, their depression, their anxiety. So becoming more comfortable with mental health management. That's hard when you don't feel like there's enough resources. I know our counselors are booked out before we, which is not conducive. Getting patients in with psychiatry is a real challenge. So, improving the connection with other resources, and that might be telehealth, which, I feel like is not as ideal as having somebody here in clinic. I like having shared visits with my CD counselor and myself and the patient. I think that's really awesome, but it's not feasible all the time. So improving just the reach out to other mental health access, I think would be something that would benefit everybody.
To listen to more SDAHO Soundbites, visit us at SDAHO.org.